Welcome back to Veterans Health Watch. I'm Kenya Griffin here at the Sleep Lab at the Baltimore VA Medical Center. Joining us to continue our discussion on sleep disorders is Dr. Ana Sanchez, a neurologist with the VA Maryland Healthcare System. Dr. Sanchez, thanks again for joining us.
Sure.
Dr. Sanchez, what types of services do you provide here in the Sleep Lab?
In the sleep lab, we perform different types of sleep studies to help us diagnose sleep disorders. We perform both overnight sleep studies as well as occasionally nap tests during the day. The overnight sleep studies are typically used to diagnose sleep-related breathing disorders, such as sleep apnea, which is a common sleep disorder in which a person intermittently pauses breathing during their sleep.
And when a veteran is referred to the sleep lab to be tested for sleep apnea, what can that person expect during the test?
So, if a veteran is scheduled for an overnight sleep study, they show up at the sleep lab in the evening, and a sleep technician is there to greet them. Typically, the sleep technician will have them answer a few questionnaires at first. Then the sleep technician proceeds to gently apply several sensors to their head, face, and body, which are then connected to a computer. These sensors are able to provide us information or help give us information about the different stages of sleep that a person enters, as well as additional information regarding breathing, snoring, oxygen levels, heart rate, and body movements. So after these sensors are applied, the sleep technician escorts the veteran into a private bedroom in the sleep lab for sleeping. The technician is there all night in an adjacent room monitoring the study. And in the morning, the sensors are removed. The patient may have to fill out one additional questionnaire, and then the patient can go home. At that point, a doctor is able to review the sleep study to determine whether or not a patient is suffering from sleep apnea or some other sleep disorder. If a patient has sleep apnea, the doctor will discuss with the patient potential treatments, including CPAP, which stands for Continuous Positive Airway Pressure.
If you determine that a veteran does in fact need the CPAP, how do you monitor them?
So CPAP is it's the most common and effective way to treat sleep apnea. It's used only at night while a person is sleeping, and it works by delivering a continuous stream of air through a mask into the back of the throat to keep an airway open, which thereby prevents a person from having these apneas or pauses in breathing. Now, the amount of pressure needed to keep an airway open depends on an individual patient. It varies from patient to patient. So in order for us to determine the appropriate pressure to keep an airway open, we may have to ask a patient to come to the sleep lab again for another overnight study, specifically for that purpose. Or in many cases now, we're able to do monitoring at home with a portable auto-titrating machine that the patient wears for a week to help determine the correct pressure. Then after we determine the correct pressure, they switch a setting on the machine, set it at a set pressure, and that patient has periodic follow-up with both a sleep doctor and a respiratory therapist.
Dr. Sanchez, thank you so much for joining us and giving such great information about the sleep lab. Before we talk to one of your patients, is there anything else you'd like to share?
I think simply just to encourage people not to ignore their sleep complaints because diagnosing sleep disorders can be relatively simple, and treating them can lead to improved quality of life as well as overall health.
Thanks again.
Sure thing.
Joining us is Mr. Wendell Johnson, an Army veteran who's benefited from sleep apnea treatment provided by the VA Maryland Healthcare System. Mr. Johnson, thank you so much for joining us.
Thank you for having me.
Could you tell us about some of the symptoms you were experiencing that led you to seek care for sleep apnea?
Yes, I was having daytime sleepiness, falling asleep at any given time, fatigue throughout the day, just irritable. and just struggling to function through the course of the day.
And once you recognized you had the symptoms, you came in for care, how were you treated or how did the VA help you?
Well, they suggested that I go to a nutritionist to help with my diet, get into the mood program to help with manage my weight so I can lose weight. And they gave me a CPAP machine to help me to breathe during the night.
So did they suggest the other options, the weight management treatment, after determining you had sleep apnea, or did you try those options first and then they said, okay, maybe you have
They
sleep
were
apnea?
suggested prior to getting onto the CPAP, but it was a continued suggestion throughout the management of the sleep apnea.
Okay. And so how has that benefited you using the CPAP machine and the other treatments you receive here?
Well, the CPAP is wonderful. I wouldn't want to be without it at this particular time. It's I've managed to be more functional during the day because of the CPAP machine.
So you're getting better sleep at night with the sleep apnea machine?
Absolutely.
Dr. Sanchez told us about the test that a veteran would have to go through to determine if they have sleep apnea. And it seems like it's in a really clinical setting. So how comfortable was it for you, or what was that experience like for you?
Well, it was quite comfortable actually, because of the fact that I could fall asleep at any given time. Once they connected me to the wires that they needed to, I fell asleep right away, and they conducted their tests, and I left that next day.
Mr. Johnson, thank you so much for sharing your story. What advice would you give to a person who's maybe experiencing some issues during their sleep?
I would ask them to seek out their primary care practitioner to explain to them what they're going through and let them suggest to go see neurologists and determine whether they have sleep apnea or not.
Well, thanks again for sharing your story.
Thank you.
We're going to take a short break, but when we return, we'll have information about chronic obstructive pulmonary disease, also known as COPD. Please stay with us.